Okay, I am just entering the exam room. I have just washed my hands. So, hi, my name is Sarah. I'm going to be your healthcare provider today. What is your name?
Hi, I'm Hattie.
Hi, Hattie. What brings you into the clinic today?
Just the neuro exam.
Great. So, Hattie and I have already reviewed her recent vital signs, and everything looks great. General appearance looks great. She's just here for a routine exam today. So, we are going to start this exam by testing her cranial nerves. So, we're going to start with cranial nerve 1, where we are going to assess her nasal patency and smell. So, Hattie, I've got 2 scents here. We're just going to start by testing her smell.
Coffee.
Great job.
Coffee.
Very good. I've got one more smell for you.
Peppermint.
Very good.
Peppermint.
Great job. So her cranial nerve 1 is intact. We're now going to move to cranial nerve 2, which is the optic visual acuity. We are going to be assessing this utilizing the Snellen chart. So Hattie, can you hold this over your right arm? We've got our Snellen chart back here, and I want you to go ahead and read the smallest line you can read on that chart.
LTFPH.
Very good. Can you cover your other eye for me?
LTFPH.
Great job. So that is considered 20/20 vision. So now we are going to be checking her visual field screening, and we are going to do this utilizing fingers here. So I just want you to focus on my eyes, and I want you to tell me when you can see my fingers coming in.
I can see it. I can see it. I can see it. I can see it.
Very good. So cranial nerve 2 looks to be intact. We're now going to be inspecting her optic fundi. So we're going to utilize the ophthalmoscope for this. Very good. So I am able to visualize her optic disc and the red reflex while I am looking there for cranial nerve 2 and cranial nerve 3. We're also going to be checking her accommodation at this time. Just go ahead and look straight at the wall. Very good. So her pupils are equal, round, reactive, and light accommodating. Now we are going to be checking her near reaction. So Hattie, I'm just going to hold my finger about 10 centimeters from your face. And I want you to focus on my finger, and then I want you to focus on that Snellen chart back here on the wall, okay? Can you look at the Snellen chart? Back at my finger, back at the chart. Very good. So her near reaction is intact. We're now going to be checking the cranial nerve 3, which is the oculomotor, the cranial nerve 4, which is the trochlear, cranial nerve 6, which is abducens. And we're checking for any kind of extraocular movements at this time. So Hattie, I'm just going to make a large H. I want you to continue to focus just on my finger. I don't want you to move your head while we're doing this, okay? Just eyes. Great job. So she was able to keep her head still. Everything does seem to be intact. We're now going to move on to cranial nerve 5, which is her trigeminal. And we are going to be assessing the motor portion of this today. So I'm just going to hold my hands here. Can you go ahead and clench your jaws for me? Clench your teeth. Okay. Can you clench down here? Very good. So everything does appear to be intact. Both in the temporal and masseter areas when she is clenching. We're now going to move on to the sensory nerves. I'm just going to utilize light touch, and we're going to do that using a cotton swab. So Hattie, can you close your eyes for me? Can you tell me where I touch you?
Cheek. Chin. Forehead. Cheek.
Very good. So her sensory nerves are intact. We are now going to move to her corneal reflex. So Hattie, I'm just going to have you kind of look up at the ceiling for me. All right, corneal reflex is intact. We are able to test that utilizing this cotton swab. We're now going to move on to cranial nerve 7, which is her facial. So Hattie, can you raise your eyebrows for me? Can you close your eyes real tight? Can you smile really big? Can you clench your teeth? Okay, can you puff out your cheeks? Great job. And so I'm also going to have you close your eyes for me. I'm going to try to open them. I want you to hold resistance. Great job. So cranial nerve 7 is intact. We're now moving to cranial nerve 8, which is her acoustic. And so Hattie, I'm just going to utilize the finger rub technique. You tell me when you hear it.
I can hear it. I can hear it.
Great job. We're now moving to cranial nerve 9, which is the glossopharyngeal, and cranial nerve 10, which is the vagal. And so I'm going to utilize a tongue depressor. Hattie, I'm just going to hold your tongue down. I want you to say all, and I'm looking for a couple of things while we do that. Very good. We're going to check your gag reflex now. Great job. It is intact. And so I just wanted to note that there is no deviation. The soft palate moves upward centrally, and the gag reflex is intact. We're now going to move to cranial nerve 11, which is her spinal accessory. So Hattie, I'm just going to kind of push. I want you to shrug your shoulders up for me. Great job. Everything looks great there. Now we're also going to be checking this by, can you push your cheek against my face or against my hand? No, push your whole face against my hand. Very good. Same thing on the side. Very good. Okay, so now we are, and everything does appear to be intact there. We're now moving to cranial nerve 12, which is the hypoglossal. So we're just going to utilize the ophthalmoscope again to visualize, and we're going to be checking for any kind of atrophy or deviations. So can you open your mouth for me? Okay. Can you put your tongue side to side? Very good. Can you push your tongue up towards the top of your mouth? And then down, push it down, stick it out. Great job. So I do not note any kind of atrophy or deviation. Can you press your tongue against the side of your cheek? Very good. Very good. Strength is great there. So now we are going to be moving on to coordination at this point in the exam. First of all, we're going to be checking for her upper extremities, and we're going to be testing rapid and point-to-point movements. So Hattie, I'm going to have you uncross your legs for me. I'm going to have you put your hands on your thighs, and I want you to keep rotating. Very good. That looks great. So now we're going to do another point to point. So I'm going to hold my finger out, and I want you to utilize your index finger on your right hand. I want you to touch my finger and then touch your nose. Very good. Let's try that with your left index finger now. Great job. She exhibits smooth and accurate movements during this exam. We're now going to move down to the lower extremities. And so, Hattie, I'm just going to hold my hands under your feet here. I just want you to tap them very quickly. Very good. Tap it like this. Very good. Let's try the other side. Great job. All right, so now I'm going to have you take your heel and rub it down your shin on this side. Okay, can you do that on the opposite leg? Very good. Hattie also exhibits smooth and accurate movements. Now we are going to have you test your gait. Can you stand up for me? So I'm just going to have you walk in this area in front of us. Start here, walk about 5 feet, and let's just assess your gait. Okay, go ahead and turn around and come back. Very good. I'm assessing your posture, your balance, your arm swing. Go ahead and walk forward for me one more time. Your leg movements all appear to be appropriate. Now I'm going to have you walk heel to toe for me. Great job. When you're walking back to me, can you walk on your heels? Very good. Go ahead and turn around and walk back to that spot on your toes now. Great job. Come stand back in front of our exam table here, and I'm going to just have you hop in place. Very good. So go ahead and stand with your feet together, and let's put your arms down to your sides. We are now going to be testing the Romberg test, utilizing the Romberg test. And so I just want to make sure that you're able to maintain in an upright posture without swaying. Can you go ahead and close your eyes for me? Just keep them closed. You're doing great. Good job. So now we're going to check for the pronator drift. So with this test, I'm going to have you stretch your arms out with your palms up just like this. And so you're going to go ahead and close your eyes for about 20 seconds. I'm going to kind of push on your arms downward a little bit. I just want to make sure that you're able to maintain your steadiness during this, okay? Very good. You can go ahead and have a seat back on the exam table. I have been noting that your motor system throughout this exam appears to be normal. When I look at your face and when I look at your hands, I'm not noticing any kind of tremors or tics or fasciculations, so that is great. So let's go ahead and assess your muscle tone. We're also going to check for your range of motion. So I am going to check your range of motion here. So let's just bring your wrist around. Have those shoulders. Can you sit up straight for me? Rotate that shoulder around. Very good. Let's do the same thing here. How's that wrist look? How's that arm look? You rotate the shoulder around for me. Great job. Okay, so now we are going to also check for your lower extremity range of motion. So can you just go ahead and extend your legs out for me? Go ahead and push them back in. Can you roll those ankles for me? Very good. Move those toes up and down. No issues there. Great job. Okay, so we are now going to be moving on. Your muscle size looks appropriate and symmetrical. I don't note any atrophy or anything like that. I've been watching your shoulders, your thighs, your hands, everything appears to be normal. So now we're going to be checking your muscle strength and testing your upper extremities. So in order to do this, I'm going to just hold my hand here. Can you push towards me? Okay, now pull against me. Very good. Check on this side. Push, now pull away. Very good. Everything looks great there. We're going to do that in your wrist. Can you make some fists for me? Can you push? Other side. Okay, pull up. Great job. We're going to test your grip strength. So let's start with this hand. I'm just going to try to pull my fingers away. Okay, let's go in this hand. Try to pull them away. Great job. Go ahead and spread your hands out like this. This is called finger abduction. So I'm going to try to push your fingers together. You try to keep them fanned apart for me. Very good. Now I want you to take your thumb and place it on your pinky finger or both hands. I'm just going to try to break that. I just want you to try to hold it together, okay? Very good. So your muscle strength in your upper extremities does appear to be intact and everything looks great. So now we're going to move to muscle strength in your lower extremities. So in order to do this, I want you to remain seated. I'm going to place my hand on your thigh. Here, can you lift up your thigh for me? Very good. Can you do it on this side? Great job. I'm going to put my hand under here, push down. Great job. And again here. Very good. And so now let's do that the same thing with the knees. Can you push out? Okay, now try to pull them back in. Very good. So let's also try that with your knees here. Can you push out for me? Okay, now try to pull them back in. Great job. Let's also try that with your feet here. Go ahead and push down like you're pushing on a gas pedal. Great job. Now I'm going to hold pressure here and I want you to try to pull them up. Great job. So I would wash my hands at this point since I have been touching her feet. We're going to go ahead and move on now to the sensory system, and we're going to check for light touch versus painful stimuli. In order to do this, I'm going to be utilizing, again, my cotton swab that I had earlier, and I also have a sharp sterile pen here. And so we are going to just check over different areas of your body. I just want you to tell me if it is sharp or soft to the touch. So you can go ahead and close your eyes for me.
Sharp. 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 Soft. 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 Sharp. Sharp. Soft. Sharp. Soft. Sharp. Soft. Soft.
Try that again.
Sharp. Soft.
I'm going to have you place your hands here.
Sharp. Soft.
Very good. So it appears that her sensory system is intact. She is able to differentiate between light touch versus painful stimuli. So we are now going to move on to proprioception. And in order to do this, I'm going to grasp Hattie's great toe. I'm going to move it around. And Hattie, I just want you to tell me what, identifying what position it is. So go ahead and close your eyes so you can't see. Can you tell me where it is? Forward. Okay. Let's try on the other foot. Tell me where it is.
Back, like bending forward.
Bending down. Very good. Okay. So now we're going to test out the vibrations. We're going to use the tuning fork for this. And so Hattie, can you just put your hand out like this? I want you to tell me when the vibration stops. Okay.
Stopped. Stopped.
Okay. We're also going to be doing this on your RP joint of your great toe.
Stopped. Stopped.
Very good. So all of her sensations were intact as far as vibrations go. We're now going to be utilizing a object, and this is called stereognosis. So I'm going to be checking to see if you are able to identify this object. So go ahead and close your eyes. I'm going to place an object in your hand. Can you tell me what that is?
Key.
Very good. We are going to place another object in your opposite hand, and I want you to tell me what this is. A needle. Very good. Okay, so now we are going to perform a test called graphesthesia. And so Hattie, I am just going to draw something on your hand, and I want you to tell me what it is. So go ahead and close your eyes.
H.
Very good. Let's try on this hand.
A line.
Okay, let's try something else.
An H.
Very good. She is able to pass with flying colors there. So now we're going to utilize a test that is called 2-point discrimination. So Hattie, I just want you to tell me if you can feel 1 point or 2 points whenever we are testing this. So let's go
1, 2, 2, 2. So 1.
No. Let's try the other one.
2, 1, 2, 1.
Very good. Okay. She was able to discriminate whether there was 1 or 2 points. We're now going to be utilizing point localization. So Hattie, I'm just going to have you to close your eyes. I'm going to touch a certain point on your body, and then I want you to touch that place on your body and see if you can keep up with where I am, okay? Let's keep your eyes closed. Very good. She is able to follow there with the point localization. So now we're going to utilize what we call extinction. So I'm going to be doing that a little bit faster this time, and I want you just to keep pointing to those areas. Very good. She is able to find those points very easily. So now we're going to move on to the deep tendon reflexes. So Hattie, we are just going to be checking your biceps. At this time, we're also going to be checking your triceps and your brachioradialis. So just gonna have you rest your arm here. Just kind of let it loose. Very good. We're gonna do your triceps here. Just let your arm loose. Just let your arm loose here. Very good. We're going to test your brachioradialis here. Very good. So we have tested her upper arms. We've tested her biceps, her triceps, and her brachioradialis. And in order to do that, we have struck each of those tendons. We're now going to move to her lower extremities. We're going to check her knee and her ankle reflex. So just let your legs loose. Great. So all of her deep tendon reflexes are intact, and this will conclude our exam today. Thank you guys for joining in.